Vegan or raw vegan? Well, watch today's video where we talk about 10 of the top blood tests that you can do on a plant foods diet.
Tune in.
Hi, it's Paul Tarbath here and
Yulia Tarbath.
nutritional lifestyle coaches are awesome healthy.
And today's video is an exciting one if you are on a raw vegan or a vegan diet. Now, I know that a lot of vegans or raw vegans think that all this blood testing is actually nothing to do with them. Well, it's not really a good philosophy to adopt because although you are eating a very healthy diet and although, of course, you're reducing your risk of a heart attack, of certain cancers, and you are taking in a lot of minerals and vitamins and antioxidants, it's still a good idea to look at your blood work at least once a year to see what's going on inside of your body and to identify whether there are any issues and what kind of action you can take. So let's dive in and talk about the 10 blood tests that you can do as a vegan or a raw vegan. And as a side note, before we dive in, I want to tell you that it's possible to face deficiencies on a vegan or raw vegan lifestyle, but then again, it's possible to face deficiencies on any diet. So this video is not about scaring you to say, what, you can become deficient in all of these things. No, maybe not, but maybe one of those or maybe two. So it's all about being proactive and taking action and, being on top, staying in charge of her health. So this is why we're making this video. Alrighty, so the first one is complete blood count, and it's also called full blood count in the UK. So it's a generic test. It will show the overall state of your health, and it's something that you absolutely definitely need to monitor once a year to see what's going on, because it will identify if you have any allergies, any possible allergies, if your immune system is weak, if your hemoglobin is low, and also if you have parasites or infections going on in your body. So it's a good idea to test. It's something that I've been testing very regularly, and actually I come from Russia, and in Russia you don't wait for something to go wrong and then you go to see a doctor. They're very proactive and they always recommend you doing a overall checkup once a year anyway. So I come from a culture where it's normal to be testing yourself once a year just to see what's going on. So this is the first one to start from. Okay, so number two is
complete metabolic panel.
Yeah.
So in this one, you'll be looking at things like electrolyte balance, you'll be looking at your blood glucose levels. So very important.
Your kidneys.
Kidneys as well. So it's a very important one just to make sure everything's working properly. And of course, people who are, sensitive to their blood sugar levels, it's a very important one to make sure that their fasting blood sugar level is at the right level.
And by the way, we've also got a blog article where we're going to list all of the blood tests that we're talking about now. So just click on the link you'll see on the screen if you want to see them all. So the next one is ferritin, and very useful to do with total iron binding capacity, which is another test that we'll talk about in a second. But with ferritin, it will also show whether you have too little iron or too much iron, which actually doesn't really happen on a vegan diet. It's much easier to become overdosed on iron when you eat animal products. As vegan or raw vegan, you don't, so it's not going to be an area of your concern for sure.
The next one is folic acid or folate. Now, this is not one that you should be deficient in on a plant-based diet, vegan or raw vegan diet.
All those greens.
All those leafy greens are going to contain lots of folate, so they're fantastic for your body. The next one is homocysteine. Now, homocysteine is a non-protein amino acid in the human body. But if you have higher than normal levels of homocysteine, this can indicate a deficiency in folate and B12 in your body. And also if you have a high level of homocysteine, this can lead to things like atherosclerosis, that's the plaque on your arteries. That's something you really want to avoid.
Increased risk of a heart attack and other health issues. So It's not something that you want to be high in. So the next one is total iron binding capacity.
Wow, that's a big long one, isn't it?
Yes,
TIBC.
TIBC, yeah. So, and that one will, again, it will assess the levels of iron in your body. And with generally speaking, most raw vegans and vegans I know are fine if they eat a lot of leafy greens. Some have actually managed to correct iron deficiencies that they even had on a meat-eating diet, but some people do experience issues with their iron levels. So this level, along with ferritin and full blood count, will help you understand if you have iron issues and if your iron is too low. And of course, if you're low in iron, then you have weakness, then you have shortness of breath, then you have fatigue and other issues that can develop because of it. So it's something to monitor as well, especially if you have issues with general issues with low iron levels.
Okay, so the next one is a lipid profile. So this is profiling the fats in your blood. So we're talking about, total cholesterol, LDL cholesterol, or
Good and bad
cholesterol, HDL cholesterol, triglycerides. So looking at all the fats and lipids in your blood and making sure that they're in the right ranges. Now, on a plant-based diet or plant foods diet, vegan or raw vegan, your numbers should be very good, but it's always good to check just to make sure that everything is in order.
Exactly, yes. And the next one is MMA, which is
methylmalonic acid.
And
yes.
it's a urine test, right?
Urine test or a blood test. And you'll find it in your body. It's a substance that you'll find in your body. And if you have elevated levels, and with other tests like homocysteine, which it could be elevated, this can indicate a deficiency at the tissue level of vitamin B12. So another important one to look for.
Well, actually, urine is UMMA and
yes.
Serum is MMA.
So there's two differences: UMMA for urine and MMA for
the
blood
test. Serum test.
So the next one is vitamin B12, and it's the vitamin B12 in your blood serum. So they are actually draw blood and check the vitamin B12 in your blood serum. Now there are other tests that you can do, which we've mentioned earlier, to do with testing B12 deficiency, and this one is just checking your level in your blood. Now there are various ranges out there, so it's really worth investigating and looking.
We've actually on our blog, if you follow the article, you'll see the suggested ranges by Dr. Williams, and it's something that we personally agree with. You want to be much higher than the standard, 200, if you like in the UK, if you're 200, then you're normal, but actually 200 is deficient.
It's not enough.
In B12, so you want to be much higher than that. You want to be like in 500 plus. Certainly they found in Japan with testing.
I believe it was 550 picograms per milliliter, so yes, it's a lot more than some of the countries, the ranges that they have.
So it's important to really know your stuff about B12, so you're in the healthy range. And last but not least is vitamin D.
Ta-da!
Or hydroxy 25, which is a more accurate type of testing, and it's pretty common for people to experience vitamin D deficiencies if they live in the cold climates and they don't see the sun, or maybe they do see the sun, but it's just not strong enough to provide you with enough vitamin D. So there's a big risk, right, involved with vitamin D deficiency.
Absolutely, and there's a lot of people out there, especially in the northern climates of this planet, who are deficient in vitamin D. And I think science is now coming to realise that it's very important that you have sufficient vitamin D in your body to guard against becoming ill and certain diseases like cancer, for instance.
Right, and 50 to 70 nanograms per milliliter is generally recommended to. It's like a general recommended healthy range that you want to be within. Okay, so these are the 10 blood tests to monitor if you're on a raw vegan or vegan diet, to make sure that you stay in tip-top shape year in and year out. And if you would like to get the complete blueprint to knowing how to test and interpret your blood test, what's optimum, what's bad, what's ideal, then I highly recommend you getting your hands on Dr. Williams' program, and we're going to post a link to it just in the description section so you can find it there. Alrighty, so I hope you benefited from this video. Did you like it? Did you benefit from it?
Thumbs up.
Tell us about it and hit the like button. Remember to leave your comments in the comments section, and of course we'll leave you with our Eat Sweet,
Keep Fit,
and we'll see you again in our next video. Bye!